The purpose of this presentation is to strengthening clinical reasoning for safe patient-centered care through real scenario. This scenario is about Muhammad Uthman, who is having a severe respiratory distress, leaning forward in a bedside table, breathing rapidly with marked use of accessory muscles, press sounds very decreased. And here, your first response to this patient will to administer start stat aerosol treatment with 0.5 cc isoeparine plus 2.5 cc normal saline. Because it is clear from the scenario that this patient is experiencing an episode of a bronchospasm. While oxygen may be not necessary, it will not correct the underlying problem. An hour later, the patient has had three consecutive aerosol treatments. He is still short of breath, and the doctor wants you to evaluate the patient further and recommend further action. You would evaluate the following here. Number one, medication taken at home, arterial blood gases, breath sounds, appearance of chest, vital signs, history of lung disease, peak flow, and history of a present illness. The other listed here are not appropriate. The doctor informs you that the patient is going to be admitted and asks for your recommendation for appropriate treatment regimen. Here is good idea to recommend IV theophylline, aerosol treatment with 0.5 cc albuterol, and peak flow before and after each aerosol treatment, and give oxygen via zero point 0.5 via 50% air entrainment mask. 30 minutes later, arterial blood gases on 50% mask, pH was 7.48, PCO2 27, saturation 88, and PO2 58. The physician requests that you place the patient on non-rebreathing mask and repeat ABGs in 1 hour. What would you do? Place patient on non-rebreathing mask and draw ABGs in 1 hour is a good idea. 1 hour later, arterial blood gases on the non-rebreathing mask reveal pH 7.47, PCO2 30, saturation 99, PaO2 189. You would now recommend decrease the oxygen to nasal cannula at 6 liters per minute. This is the best of the choices given. It is now 2 days later. The patient is doing well. Lungs are clear and respiratory distress is minimum. Arterial blood gases on nasal cannula at 2 liters per minute. pH 7.41, PCO2 38, saturation 98, PO2 110. The physician asked for your recommendation for home therapy. I think it will be a good idea to give 2 puffs of Intel and give 2 puffs of albuterol, 2 puffs of flavonoid, and asthma education. This will end our case. Thank you for listening.